When coronavirus first broke out in China, it threw the world into the abyss of fear, owing to the huge number of confirmed cases and deaths. Wuhan, a city with a long history of battles, became an epicenter of the deadly virus. Temperature checks, forced quarantine, mandatory face masks became the order of the day. Bit by bit, people deserted the city out of fear. A virus we even didn't know existed spread faster to the corners of the world. Kenya not spared either. And on 13th March, at the foot of Arambe House, accompanied by government officials, Health CS Mutahi Kagwe announced Kenya's first COVID-19 case, throwing the country into frustration and panic.
I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya. The case was confirmed on the 12th, which was last night, as the first one to be reported in Kenya since the beginning of the outbreak in China.
The government then embarked on a journey that will see the country combat the spread of the virus. President Uhuru introducing raft measures, including dusk to dawn curfew, cessation of movement in and out of Nairobi, Mombasa, Kilifi, Kwale and Mandera, in a bid to flatten the curve.
That effective Friday, 27th March 2020, there will be a daily curfew from 7 p.m. to 5 a.m. in the morning. And this shall be in effect in the territory of the Republic of Kenya, with all movement by persons not authorized to do so, or not being medical professionals, health workers, critical and essential service providers, being prohibited between these hours.
As Mutahi Kagwe continues to shout on the looming danger that awaits us on his daily press briefings, a section of Kenyans have acted on defiance and a carefree attitude, calling on death on their doorsteps. A section of youths recorded themselves in an ambulance, trying to beat police roadblocks from a drinking spree that went all through tonight.
Yeah, I think more public awareness needs to be done so that the seriousness of the disease is internalized by most of the Kenyans, because going that extra mile just to go for a party or just to break out of the curfew areas is really serious, and it's like people don't really understand the seriousness of the disease.
Spectacular scenes of people breaking out of quarantine facilities have also emerged, raising eyebrows of why Kenyans are chasing death. Armed with their bags, they clung the perimeter wall, jumped over, blending with the crowd as if nothing happened.
It really beat my logic if they really understand the gravity of this disease. And it's a sad state of affair that you've been there for over 1 week, you only have less than a week to go, and you're breaking out in full of people capturing you. So that, and it means that you'll be caught by the arm of law by the government and be taken back for another 14 days or more. So I think Kenyans, me included, need more information, but I don't know whether it's a cultural thing or it's just a peer. That one I think was a peer pressure thing. So I think there should be a lot of centralization going on in these quarantine camps or areas so that people can understand how serious this disease is.
Lakini mjue ya kwamba wale ambao hawafuati, wale ambao mnaona wakiruka wakitoka kwa quarantine facilities, hao watu ni kusema wanataka kutoka huko waingie vijijini wapeleke ugonjwa huko vijijini.
Why are Kenyans defiant of government directives at a time when health and life are at stake?
The only way to flatten the curve is to stay at home. If you have to go to the public places, wear a mask as stipulated by the government. And the simple thing, wash your hands.
We can be a perfect example of a people living in harmony and a people who have defeated what others in the world have been unable to defeat:
we can overcome.
Fred Oko for Kenya News Network.